So good evening, my dear doctors. Good evening, everyone. So just let me know if I'm audible and visible both. Just you can write in the comment section. Okay. So the purpose of these classes, this is a new channel from DocTutorial. It is a DocTutorial MBBS, and a lot of videos are there already from physiology, anatomy, pharma. So purpose of this lecture is to help MBBS student to write their professional examination. So this is basically tailored according to their MBBS NMC norms. So what kind of questions are asked, what are the topics, and how they can get good marks. So I will try to take as many as lecture in this channel, which will be helpful for MBBS first year student. And today I have taken the topic calcium metabolism. Because a lot of students have asked me to take this topic, calcium metabolism. They can ask you clinical question, they can ask you short note, they can ask you MCQ regarding that, because it is combination of three different hormones. So because it is a combination of three different hormones, so it is a concept based topic. That is why I have taken this topic. So let me start without further ado. The calcium metabolism. So question number one, how many hormones are involved in this metabolism? So number one is parathormone. If we see how many hormones are involved, so number one, the most important is parathormone. So they can even ask you, write a short note on function of parathormone. Number two is vitamin D3. Vitamin D3. And number three, we can say calcitonin. So there are three systems involved, there are three hormones involved, and if you understand the function of these three hormones, it will be easy to answer short note or long note. Now, see, parathormone. If someone asks you how to differentiate the function of parathormone with vitamin D3, what are the basic thing? So if you see parathormone and vitamin D3, they are having almost same function, but the arrows are different. Like for example, the parathormone increases calcium and decreases phosphate in the blood. The point to be noted here is that in the blood. So if you see in the blood, what will happen to calcium and phosphate level that is done by parathormone? Calcium level will increase and phosphate level will decrease. Now, what will happen to vitamin D3? What is the function of vitamin D3? Same action, but in the same arrow, it will increase both the level of calcium as well as level of phosphate. So if suppose that there is a patient in which calcium is more, phosphate is more, what can be the cause? Hypervitaminosis of vitamin D3. If calcium is low, okay, phosphate is also low, what can be the cause? Answer can be less vitamin D. It can cause rickets in the children and osteomalacia in the adult. So by just knowing this fact, in the exam you can write question, a lot of points can be written if you know this point, that vitamin D3 is increasing calcium in the blood as well as phosphate in the blood. On the other hand, parathormone is increasing calcium but decreasing phosphate. Now, what happened to calcitonin? What is the main function of calcitonin, doctor? See, calcitonin calcium को कम करता है. क्या करता है calcitonin? Calcitonin decreases the level of calcium in the blood. It has no role on phosphate. So there are three hormones we can see here: parathormone, vitamin D3, and calcitonin. If you remember this much, believe me, you can understand, you can remember all the points related to these three hormones and how they are helping. Now, just by understanding the point that parathormone increases calcium in the blood, now you will answer my question. If parathormone, I have told you, parathormone is increasing calcium in the blood, so it will increase absorption of calcium from intestine or not? Yes. So if you know this point, कि parathormone increases calcium in the blood. So by this you can write the function of parathormone. अब एग्जाम में आया short note on parathormone. So you can simply write that calcium is increased from intestine. Reabsorption of calcium is increased from intestine as well as from kidney and from bone. So just by understanding this point, that parathormone increases calcium in the blood, decreases phosphate in the blood. अब ब्लड में कैल्शियम को बढ़ाता है तो इंटेस्टाइन से कैल्शियम के एब्जॉर्प्शन बढ़ाएगा या कम करेगा? It have to increase. From kidney again, reabsorption of calcium is more. Bone, it causes bone lysis, so it will also increase calcium. So now if they ask you in the viva or in your examination function of parathormone, you have to remember only two things. One is that increases calcium in the blood, decreases phosphate in the blood. So in the kidney you can say it inhibit phosphate absorption. It inhibit phosphate absorption. One more point. एक कैल्शियम बढ़ाता है और फॉस्फेट को कम करता है. कैल्शियम बढ़ा रहा है और फॉस्फेट को कम कर रहा है. वहां गया, कहां गया? दैट इज कैल्शियम को बढ़ा रहा है, फॉस्फेट को कम कर रहा है. सो कैल्शियम इज इंक्रीज्ड इन द ब्लड फ्रॉम वेयर? फ्रॉम इंटेस्टाइन, फ्रॉम किडनी. एंड हाउ फॉस्फेट कैन बी डिक्रीज? बाय इनहिबिटिंग कैल्शियम absorption from the kidney. So all the function can be understood if only one point is clear to you. Calcium is more, phosphate is less. One more point. Bone. I have told you, parathormone causes bone lysis, increasing the level of calcium. Now, this is a very, very important clinical concept. For the exam, they will ask you the clinical basis of this hormone. Now, please try to understand how it works on bone. So, parathormone, of course, you know it causes bone lysis. So, its receptor will be an osteoblast or an osteoclast. First question. Purpose of parathormone is to increase calcium. It causes bone lysis. So next question they can ask in the examination, their receptors are an osteoblast or an osteoclast. Now you might be thinking it causes bone lysis, so receptor will be on osteoclast. But this is wrong. Receptors are not on osteoclast, but their receptors are on osteoblast. So if they ask you to write a detailed function of parathormone, then you have to write the receptor of parathormone is on osteoblast. And this will activate a ligand, and that is called as rank ligand. This is called as ligand, and that is called as rank ligand. Now, rank ligand is working on a cell, which is that osteoblast or osteoclast. Now this will work on osteoclast. This is going to work on osteoclast, and this osteoclast will cause bone lysis. It will cause bone lysis. अब ये करेगा bone की lysis. Is it clear or not? So parathormone will activate osteoblast. Osteoblast will relate rank ligand. Rank ligand will activate osteoclast to cause bone lysis. So parathormone is not good for the bone. So rank ligand is good for bone or bad for bone? So rank ligand is bad for bone. So who is preventing this lysis of rank ligand? Answer will be OPG. What is OPG? Osteoproteogenin. Osteoproteogenin. So OPG is the good hormone or bad hormone? For bone, it is good or bad? It is good. OPG is inhibiting rank ligand. Rank ligand is activating osteoclast. Osteoclast causes increase in calcium level. Is this clear, doctor? So this coming again to the same concept. Parathormones are increasing the level of calcium, decreasing level of phosphate. Only this point. Now, increased level of calcium from where? From intestine, from kidney, and from bone. Is this clear? Now, vitamin D3, it causes increase in the level of calcium as well as increase in the level of phosphate. Now, next point, OPG is, you know, OPG is a good hormone. Why it is a good hormone? Because OPG is inhibiting rank ligand. Let me recap this point. Parathormone will act on osteoblast, relate rank ligand, initiate osteoclast to increase calcium. Now, rank ligand is not good for your bone, so it is constantly inhibited by a hormone called as OPG, osteoproteogenin. Next point, osteoproteogenins are activated by which three hormones? Answer will be growth hormone, testosterone, and estrogen. So growth hormone, testosterone, or estrogen, these three are activating OPG to inhibit rank ligand. So these are good for your bone or bad for your bone? Of course, they are good for your bone. They are good for your bone. ये bones के लिए अच्छे हैं because they inhibit rank ligand. This is the reason estrogen become less after the menopause and there is post-menopausal osteoporosis. So post-menopausal osteoporosis, the reason is that when estrogen become less, osteoproteogenin become less active and that causes osteoporosis. Clear? Yes, you are correct, Dr. Devashish. It is bad for the bone. Is this clear? So this is concept, so very, very important. So receptor of parathormone is on osteoblast, activate osteoclast. Now that is the reason we are having post-menopausal osteoporosis. So in the exam of MBBS, they will ask you the clinical. What are the clinical of this hormone? After menopause, when estrogen become less, OPG become less active, and there is osteoporosis. And we know drug of choice are bisphosphonate. It is for pharma purpose, but for MBBS first year, this much is sufficient. Now, next point, I have told you about vitamin D3. Vitamin D3, how it is formed? Vitamin D3, ultraviolet rays falls on the skin. Skin has, what is the precursor of vitamin D3? 7-dehydro cholesterol. So when ultraviolet rays falls on the skin is having a precursor, 7-dehydro cholesterol. This is converted into cholecalciferol. This is converted into cholecalciferol. So in the exam, in MBBS examination, they can ask you the function of vitamin D3 and the formation of vitamin D3. But we know it is from sunlight only. Okay. So when sunlight falls on your skin, we are having 7-dehydrocholesterol and ultraviolet rays will convert it into cholecalciferol. Now this cholecalciferol is going to what? In the liver, it convert into what? 25-hydroxycholecalciferol, isn't it? Where? It is happening in the liver. It is happening in the liver. 25-hydroxycholecalciferol. So in the liver, the next step will be happening and convert into 25-hydroxycholecalciferol. Now, thank you, doctor. Now this is going to your kidney. In the kidney, in presence of 1-alpha hydroxylase and the hormone parathormone, it converts into 1,25-dihydroxycholecalciferol. So it's very clear, very simple. So our skin is having 7-dehydrocholesterol. When ultraviolet rays falls on our skin, it got converted into cholecalciferol, then 25, and then 1,25-dihydroxycholecalciferol. And this is actually the main hormone, and it is called as calcitriol. It is called as calcitriol. It is the main hormone which is increasing your level of calcium as well as phosphate. Okay, so this is how calcitriol will help you. Now, which is the major circulating form? When you are taking the supplement of vitamin D3, which supplement? Anyone can answer my question? When we are supplementing vitamin D3, we are taking 25-hydroxy or 125-hydroxy. What do you think? जब हम supplement देते हैं ना, you have to take this once a week, 60 units. Okay, it is 25-hydroxycholecalciferol because this is costly. In the kidney, it can be converted into 125-dihydroxycholecalciferol. So the only two conditions in which calcitriol have to be given. So what are those two conditions? Can anyone tell me what are the two conditions? Two conditions जहां पर आपको calcitriol ही देना है. One is CKD, chronic kidney disease, and second is hypoparathyroid. Because kidney is needed to convert this, and parathormone is also needed. So regarding doctor, vitamin D3, point number one. Point number one is that it increases the level of calcium, it increases the level of phosphate. Regarding parathormone, increases calcium also, increases phosphate also. So parathormone arrows are both together. So if you want to see a patient is having more calcium and less phosphate, what is your diagnosis? It will be hyperparathyroidism. It can be hyperparathyroidism. If calcium is low, but phosphate is high, it will be hypoparathyroidism. It's very clear. If calcium is very much, phosphate is very low, hyperparathyroidism. If calcium low, phosphate high, hypoparathyroidism. So in the clinical of your exam, you can write the clinical, and that is hyperparathyroid and hypoparathyroid. If calcium is very much, calcium is very high, phosphate is also very high. अगर कैल्शियम भी ज्यादा है और फॉस्फेट भी ज्यादा है, it means hypervitaminosis. If calcium is low, phosphate is also low. In the children, it can be rickets. In the adult, it can be osteomalacia. Is this clear? So these are the function of three hormones which are important for calcium metabolism. Now I will show you a clip from DocTutorials. Okay, I have taken this clip to tell you the function of calcium. So let me start this clip. You can see. There are so many functions of calcium. Like one, it is helpful, important for genesis and maintenance of action potential, especially in cardiac and smooth. So in the skeletal, you know, it was because of the sodium. The depolarization was because of the sodium. But here, the action potential of the heart as well as the smooth is mainly due to calcium. Okay. Number one. Number two, it is important for genesis of pacemaker potential, the pre-potential in various pacemaker tissues like SMA, AEM. So calcium is important for pre-potential or pacemaker potential. Number three, during excitation, contraction, coupling, during muscle contraction, this calcium is needed again. Then this is important for excitability of nerve and muscle. Calcium is important for stabilizing the nerve and muscle. It is stabilized by surrounding the voltage gated sodium channel. Calcium is a cation. Sodium is also cation. It will repel. It will guard. It will not allow all sodium to go. Otherwise, your nerve will become very excited. So it balances it out. The stability and excitability depend on this calcium. This is very, very important thing. Okay. Then it is also important for cell division, for bone formation. Which action? The mineralization of the bone. Then calcium is important for exocytosis. Calcium mediated exocytosis of various hormones, various enzymes from the gland cell. Then calcium is also important for neurotransmitter release from nerve terminal. Because from nerve terminal, whenever you need to release any transmitter, you need to do exocytosis for that against calcium, you know, that also for NMDA receptor. So this was a clip from DocTutorials MBBS curriculum I've taken so that I can tell you about what are the function of calcium. Okay. Now I will tell you how to write in the exam. अब ये चीज एग्जाम में कैसे लिखना है, तो आपको हेडिंग डालनी है फंक्शन ऑफ कैल्शियम. फंक्शन ऑफ कैल्शियम. In the MBBS exam, they will ask you what is the function of calcium. So we know, number one, you know about that muscle contraction. Muscle contraction के लिए हमको क्या चाहिए? कैल्शियम चाहिए. Number one will be muscle contraction. Everyone knows about that. Number two, जहां पर भी एक्सोसाइटोसिस होता है, it can be insulin, it can be neurotransmitter, it can be acetylcholine, whatever, you need calcium. So exocytosis of neurotransmitter of hormone in the beta cell. Beta cell में इंसुलिन को निकलना होता है, क्या चाहिए? कैल्शियम. So whenever there is exocytosis of anything, you always require calcium. Number two, calcium. Number three, you know, it's very, very important for stabilizing voltage gated sodium channel. So number third function, stabilizes sodium channel. Calcium ही sodium channel को stabilize करता है. So you can say that is why if there is less calcium, अगर आपकी बॉडी में लेस कैल्शियम में क्या होता है? इरिटेबिलिटी, इंक्रीज एक्साइटेबिलिटी. अब आपको एग्जाम में कैसे लिखना है? इन द एग्जाम यू हैव टू राइट द हेडिंग फंक्शन ऑफ कैल्शियम, देन पॉइंट वाइज. नंबर वन, मसल कॉन्ट्रैक्शन. You know, for actin and myosin contraction in detail we have discussed. Exocytosis of insulin neurotransmitter. Number three, stabilization of sodium channel. अब यहां पर आपको explain करना है. You have to explain this in the exam. What is the stabilization? Decreased calcium will cause increased excitability. Decreased calcium will cause increased excitability. क्यों? Calcium is stabilizing the membrane. Calcium is stabilizing the membrane. So if calcium become low, automatically stability, excitability will be high. It causes carpopedal spasm. Carpopedal spasm. हाथ ऐसा हो जाएगा. Hand will be like this. If calcium is low, more action potential will come, and this will cause muscle contraction. So hand will be like this. It is called as, you can write in the exam, carpopedal spasm. If calcium is more, it decreases excitability. इतनी ज्यादा स्टेबिलिटी हो गई कि एक्साइट ही नहीं हो रहा है. इट इज ऑल्सो नॉट गुड. आप स्टेबल हो जाओगे, पढ़ ही नहीं रहे हो. ओके, दिस इज ऑल्सो नॉट गुड. इन द एग्जाम आइदर समवन आर वेरी मच एक्साइटेबल, इतने एक्साइट हो जाते हैं कि पढ़ ही नहीं पाते हैं, और कुछ लोग एकदम रिलैक्स हो जाते हैं. सो बोथ इज नॉट गुड. मध्यम मार्ग इज ऑलवेज गुड एनीवे. So muscle contraction, exocytosis, it stabilizes. And number fourth and the most important, अगर आपको याद होगा, secondary messenger. Calcium is the secondary messenger of GQ receptor. GQ receptor आपको याद होगा, G protein couple receptor, GPCR. G protein couple receptors are of three types: GS, GI, and GQ. GS and GI secondary messenger is cyclic AMP, and for GQ it is calcium. So calcium is also secondary messenger. So these are the function of, you can say, calcium, and this is how we can understand the metabolism of calcium. So let me recap it. अब आपको एग्जाम में लिखना है तो क्या लिखोगे? In the exam, number one, calcium metabolism, 3 hormones. Number one is parathormone, number 2 is vitamin D3, and number 3 is calcitonin. Parathormone कैल्शियम को बढ़ाता है, फॉस्फेट को कम करता है. इट इंक्रीजेस द लेवल ऑफ कैल्शियम, डिक्रीज लेवल ऑफ फॉस्फेट. विटामिन D3 कैल्शियम भी बढ़ाता है, फॉस्फेट भी बढ़ाता है. So in the exam you read point number 2, vitamin D3 increases calcium also, increases phosphate also. Number third is what? Calcitonin. Calcitonin decreases the level of calcium. Okay, so अब आगे क्या लिखोगे? Parathormone can increase the level of calcium on working on intestine. It can work on kidney as well as bone. अब कैल्शियम एब्जॉर्ब कहां पर होगा? खाना खाने से होगा, इंटेस्टाइन से एब्जॉर्ब होगा. सो पैराथॉर्मोन विल हेल्प इन एब्जॉर्प्शन ऑफ कैल्शियम किडनी में. किडनी से निकल रहा कैल्शियम वापस कर लेगा, इट विल रीएब्जॉर्ब द कैल्शियम. और फॉस्फेट को इनहिबिट, इट विल इनहिबिट द एब्जॉर्प्शन ऑफ फॉस्फेट, तो फॉस्फेट यूरिया कराएगा, इट विल कॉज phosphatemia. So this is about the metabolism of calcium and their function. I know your exams are very near, so I will not take much of your time. If you have any doubt, you can ask me, or I will take lecture next Thursday. I will try to take. Or if you have any doubt, you can ask me in the comment section regarding this topic or any topic you want me to discuss. You can just message me. Else, I will take other lecture. Because this channel of Doc Tutorials is only based for MBBS curriculum, so that in the exam how to write, what are the topics that are important. किताब में तो बहुत दिया रहता है, एग्जाम में क्या क्या लिखना है. तो कैल्शियम पे आ गए तो 3 हार्मोन, ठीक है. विटामिन डी कैसे बनता है, फंक्शन ऑफ विटामिन डी 3, फंक्शन ऑफ पैराथॉर्मोन. इज दिस क्लियर? ओके. So thanks doctor for joining. We'll take next class soon. Till then, bye bye.